Is the fertility cliff a real thing? In other words, when the clock strikes midnight and you're on the eve of your 35th birthday, you go from 34 to 35, do all of your eggs magically disintegrate or turn bad? Of course not. I'm Dr. Lucky Seacon, a double board certified OBGYN and REI, and I want to explain why this notion of a fertility cliff is not an accurate way, or a helpful way for that matter, of thinking about reproductive aging. So here's the deal when it comes to reproductive aging. We're born with all of the eggs that we're ever going to have. We're born with a finite number. We can't make new eggs and we lack repair mechanisms. So over time, our egg count and our egg quality are always going to be declining. They don't decline at a linear rate. And we tend to see a pattern where you lose eggs at a faster rate and egg quality tends to decline more rapidly as we get to our mid-30s and later. So rather than a cliff, it's more like a continuum. And something to know is that when you're in your early 20s to very early 30s, not a whole lot is changing that quickly. Of course, we're always losing eggs, and yes, the quality is declining, but it's very slow. That's what the typical pattern is. And of course, it can be different for different individuals. Now, I know I'm going to offend someone when I say this, but even in your 20s, when you're thought to be in your reproductive prime years, you still do not have perfect eggs. Nobody has perfect eggs that will make 100% perfect embryos. Even in your 20s, if I was to take all of the eggs that I could get to, if I was to do an egg retrieval and turn those eggs into embryos, I would expect about 20 to 25% of those embryos to have genetic imbalances or errors that would limit their reproductive potential, not allowing that embryo to implant or stay implanted. Think about that. 20 to 25% of embryos being abnormal is not a small number, and that's as good as it can possibly get. So it's important to remember that that's our starting point. And then if we think about at age 35, if we play through that same scenario, we see numbers more like 35% of embryos being abnormal, but 2/3 of those embryos are going to have high reproductive potential. So the odds are still in your favor. And at 37, 38, when a lot of patients will automatically assume, oh my gosh, my egg quality is so poor, what we see is more like 50-50 in terms of the proportion of embryos that will test as normal versus abnormal. And at 40, it's more like 70% of embryos will be abnormal and 30% would be normal. And yes, that is a drastic change. But remember, there's still an ability to make a normal embryo. And every month or every cycle, there's a random selection of an egg, that one lucky egg that gets selected to be the winner, that gets to ovulate. And what this data from all the embryo testing that we do is telling us is that at 38, at 40, even at 42, even at 45, we can make normal embryos. But they become few and far between, especially as we approach our mid-40s. And that's the issue. So yes, even in your early to mid 40s, when it's thought to be more challenging to get pregnant, you can ovulate a healthy egg that then jumps through all the other hoops that it has to. It gets fertilized, turns into an embryo, and actually implants. That can happen. But remember, you're only ovulating one egg every cycle. So it's often going to take so many more ovulations to have that lucky egg be released and to have all of those things line up that need to line up. And when pregnancy does occur, there is this worry of this heightened risk that the embryo that implanted to result in that pregnancy had a much higher probability of being abnormal. And this is why there's such a high risk of pregnancy loss, miscarriage in the first trimester, especially as you get into your 40s. So that's the issue of egg quality and how it changes with age. When we think about egg quantity, yes, that's also changing with age, and the rate at which it's changing is kind of mirroring the changes in egg quality in that they hasten or become more rapid or drastic as we get older, especially in our late 30s and 40s and beyond. But this is really only important because that's going to limit the efficiency of treatments like IVF. We're not going to have access to as many eggs. It's going to be harder to respond. And so treatments like IVF, which can often help, especially when there's egg quality issues, because you can use things like PGT, they're not going to be as effective because we'll have less eggs to work with. I guess what I'm trying to say here is that you have every reason to feel hopeful, even if you're over the age of 35. You haven't fallen off of the fertility cliff. But it's important to be realistic. It's important to have your eyes wide open going into every attempt, understanding what the issues are and why it may take longer to ovulate a healthy egg and get pregnant, and why there is concern that you could be at a heightened risk for miscarriage. And to know that there are interventions and things that you can do to be proactive and try to get ahead of all of this. The simplest way to apply this information is knowing when to seek help. If you're in your 20s or your early 30s, yes, it makes sense that you could try for up to a year before seeking testing or intervention. If you're approaching your mid-30s, especially if you're 35 and older, don't wait longer than 6 months. And if you're over 40, I wouldn't take longer than 3 months to see a fertility specialist.